Hello, hello, everyone, and thank you, families, for being with us tonight with our Getting to Know Hillsborough County Public Schools sessions. This tonight is going to be a great session. We are going to learn all about our Student Services Department. Here we have our entire Student Services staff here to talk about all the great resources that they provide, not only to your students, but to families as well. So listen attentively. You're going to learn a plethora of information, some information you may know and may not know, but what a time like as such as this for us to get to know when a lot of things are going on and we need so much support. So the timing of this session is just so awesome. And I just thank this team for answering the call and saying yes. So right now, I'm going to introduce none other than the General Director of Student Services, Mrs. Holly Saya. Holly.
Thank you so much, Angela. What a wonderful presentation. We're so happy to be here for our families this evening. We know families that right now, with the struggles not only of COVID in the past, but the recent storm, we hope that each of you fared well in the storm. But please know that each school has a student services staff on site that can help you. And Angela, if you go to the next slide, here with us this evening are the supervisors of those various programs. Now, even if there's a vacancy at your school, every school has at least one of these team members. We have school counselors, we have school psychologists, school social workers, and school health services staff at each school. We also have at the district level through our mental health plan, a clinical care supervisor, an emotional wellness supervisor, and our quality assurance manager who helps with our MRT. So we are very pleased to be able to be here for families tonight so that all families know that you have student services team members to support you. And if you ever have a question, you are always welcome to contact us at the district office. So thank you, and we're going to begin now with learning about our school counselors.
Good evening. I am Shanshira Quinn, one of the counseling supervisors here. I work with the middle school counselors. And
I'm Angelique Zenick, and I'm the high school counseling supervisor. We do have one other team member who's not with us this evening who oversees elementary school counselors, and that's Tracy Graves.
Share a little bit about how you, the services that are offered through school counseling and how you can, of course, access those services. So school counselors, also formerly known as guidance counselors, but we are now school counselors, deliver services in the following areas for elementary, middle, and high school students. So we address academic achievement, personal social development, career exploration and development, and we work with parents and community as well. So school counselors, when it comes to the academic achievement areas, school counselors use school-wide data. They look at that data to determine what changes need to be made, whether that's in the scheduling process in different academic areas. And so they work to promote systemic change that way. Also, school counselors provide individual counseling where they're providing that academic advisement for students, small group counseling where they're working with small groups of students on like study skills and things like that. And also they provide large group or classroom counseling lessons as well. The next area is the personal social development areas. And with this one, school counselors provide small group and or classroom lessons in areas like character development, personal safety, bullying, and even grief counseling. And they do this on an individual level with students as well, if it's necessary. Also, school counselors work with students on their career exploration and development. And again, they do this across the board from elementary all the way through high school. It starts out as exploration and looking into interests and moves on up through actually developing a plan, post-secondary. And they do this through individual classroom and large group sessions as well. And then, of course, we work with our families, we work with parents in the community, where we provide parent information sessions, sort of like this, based on the needs of the school, based on the needs of the students at that particular school. Also, counselors work with students, parents, teachers, administrators, and outside agencies and organizations in order to provide the best educational environment and opportunity for all students, because we do know that it takes a community working together for our students.
Okay, thank you, Shanshira. So in addition to all the information that Shanshira just shared, school counselors are first and foremost student advocates. So they're there to advocate on behalf of your child, whether it's for something at the school level or outside of school. They are there to support students and really they're in their corner. They do a lot of, many times, some crisis counseling if there's something that's going on, maybe at the school level or even in the student's personal life. If it's something that is greater than what can be addressed during the school day, then they might refer for outside services as well. A lot of times, people don't think of school counselors as mental health professionals, but they are. They are trained in counseling theories and practices. And so they do have knowledge of social emotional learning, bullying prevention and suicide prevention, and drug and alcohol awareness and prevention. Obviously, these are three very critical areas, particularly, bullying is something that, we're seeing a lot of, unfortunately. And so if your child is experiencing anything in those areas, we want them to reach out to their school counselor to get some assistance. And then certainly if something, like I said, is needed greater than what they can provide at the school level, then we would advise to offer some referrals outside of the school. In addition, we do offer academic counseling and advisement. In elementary, obviously, that's probably not as great as it is in high school, but certainly as students are starting their school careers in elementary, there is a piece of that impacts once they get to middle school, and it's a little bit more in depth. And then certainly once they get to high school, those high school schedules are very important based on what they want to do when they graduate. So in addition to deciding what kind of classes they're going to take, the counselors will meet to discuss their individual student planning. What are their goals? What do they want to do with their life? And so that helps drive what they might take in school, particularly in high school. And then certainly promotion is critical in elementary and in middle school. And then we are focused on graduation once they get to high school and making sure that they graduate successfully with a high school diploma. During that time, and actually even before that, so as Shanshira mentioned, they do work with students with career exploration and development. But once we get to high school, it's going to be a little bit more focused. And so we are going to say, what are your goals? What are you going to do after high school? And if you're planning on doing some post-secondary education, then we are going to help you with applications. If you're looking for scholarships, assistance with looking for scholarships and applying for them, and also applying for our state scholarship program called Bright Futures. Their counselors are critical in that arena. And then certainly other things, more in-depth career exploration, they can assist with that as well. Not every student's going to college. What are they going to do when they graduate? We want them to have a plan, and that's the most important thing. Thank you.
Good evening. I'm Myrna Hogue, and I supervise school social work services. All of our schools in Hillsborough County have a school social worker, which is either full-time, or at some of the schools, they are there 2 to 3 days a week. You can move forward, Angela. Thank you. So when you think about your school social worker, think about them as working with students and families to overcome any barriers that may be there to ensure academic success. So putting plans in place to alleviate any barriers. And we do this in lots of different ways, and barriers can look different to different students, different families at different schools. So here's some of the things that we do to help alleviate those barriers and to work towards academic success. Your social worker is involved in diagnostic assessment and evaluation. So students who have been through the MTSS process, and we'll talk about like what that means a little bit later, but who may need an evaluation. Social workers complete what's called a social developmental history. And it's really a part of an evaluation that really tells the full picture of that student in school, in the community, and at home. We also do attendance remediation plans. So working with families to alleviate any barriers to coming to school every day, and helping families connect with resources that they may need to make sure that students can come to school every day to be successful. Also, a big part of our role is case management services, and really now more than ever, we are really helping families to make sure that basic needs are met. And as Ms. Saya said at the beginning, COVID has really been impactful to many families. So we have more families than ever that really need access to basic needs. So whether it's housing or food or clothing, transportation, looking for jobs. So your social worker is an expert on resources and can help families plan so that we can alleviate those barriers. They're also experts in special populations. So part of my role is overseeing our McKinney-Vento homeless education team and also our fostering education team. So we work closely with our homeless students, with foster care students, with teen parents, any special population that may have an additional need. We work closely with to put plans in place to alleviate those barriers. We also play a big role in providing counseling services at schools. So often people don't realize that social workers are trained in mental health, and many of your school social workers are also licensed mental health professionals. So they do a lot of individual group counseling to address the social, emotional, behavioral, and mental health needs of students. They also provide counseling as a related service based on IEP goals. So students who may have counseling to deal with maybe some social skills or anxiety or some anger, the social worker may be providing that service based on the goals of the IEP. We also do a lot of connecting families with community providers for more intense therapeutic services. So the counseling that social workers provide is really focused on education and academic success and kind of some short-term brief counseling. But for students who may need some more intense services, we would help to make that connection. We're also very involved in suicide assessments or screenings, threat assessments. We're part of that school team working closely with the school counselors, with the school psychologists, to make sure that our students are safe. And you'll hear more about that also later. Many of our social workers are part of our district crisis team as well. Social workers do a lot to really engage parents. So whether it is doing parent education groups like this or at the school campus, conducting home visits, just communicating with parents so that parents can be a part of that team that works with the school teams to make sure that students have everything that they need. Another big role that social workers have is making sure that schools are connected with community agencies and keeping up with those resources that are in the community. So both internal resources, what's on the school campus, and then what's surrounding the school out in the community that parents and students can participate in or receive services from. So every school has a resource map. And if you would like to see your school's resource map, please reach out to your school social worker and ask them for a copy. Many of them post it on their websites or put it on Canvas or put links to it in maybe a school newsletter. But the school's resource map really identifies all the resources that are available to students and families that can, again, address any of those barriers to academic success. Your school social worker collaborates as part of a multidisciplinary team. They're working with students, families, teachers, their colleagues at schools to make sure that plans are implemented and that students are receiving the services they need. And they're also big advocates. They really do advocate for what's best for students and families. So reach out to your social worker if you need any support. They are really there to help. They are not there to take away children, which has been kind of the way people think of social workers in the past, but that is absolutely not the case in our schools. We are there to help families make sure that you have access to everything that you need. Even if, you know, with the storm and with housing, today, social workers were working with families on helping, you know, identify hotels or services in the community, getting families what they need. So we're out there and we're always there to help students and families access everything that they need to be successful. So please reach out. Thank you.
Good evening. My name is Maria Russ, and I'm the supervisor for School Health Services. Next slide. So we are there as the access for healthcare. We know oftentimes the co-payments, sometimes the providers not being available, the offices aren't open, and so forth. And so we want to let you know that there's a school health services staff person at every school site, and there's a school nurse and a school nurse practitioner over each area or schools. So know that there's always access. And so what we want to do is make sure that there are no barriers that interfere with your child attending schools. So we do everything from medication administration, procedures, providing treatments, and we also do a lot of training to make sure that all of your child's health needs are met at school. We have at least 3 to 4 staff. We trained CPR and first aid at the school sites. We do we work with emergency management. We track like how many kids are in, staff members are EMS out, and so we try to support that and we keep you informed. We certainly allow parents to make decisions because we know that your children best, while the orders have of course come from providers. We totally support and believe in that the parents know their child best and are critical as part of the team. All of the interventions that our nurses provide are evidence-based. They go through extensive training. We have elaborate partnerships with, University of South Florida, College of Medicine and Nursing and Public Health and Pharmacy, as well as Tampa General, All Children's, Johns Hopkins, Baycare. So that we have a large support system with the major healthcare organizations and Florida A&M University, among University of Florida and other colleges that provide extensive research training and evidence-based, and so it's a continuous loop. We're critical in the care coordination, so it's critical that we have a release of information, so that the purpose of that is that we have a continuous care going in the school, home, and back to the provider's office, so that the care that is provided to your child, rather it be medication or procedure or treatment related, that it's a biofeedback in terms of that we're making sure that we're doing the best thing that we can to serve your child while at school. We are also great at collecting data and information, rather it be on your child's blood sugar levels or blood pressure or any of those things, so that your provider and you, as you all are making that family decision, that you're making the best decisions for your child. Certainly we provide acute and chronic disease management, for asthma, seizures, diabetes, 25,000 children in our schools have some type of life-threatening allergy. We want you to know that your child is not, often not alone with their medical condition. And so we are skilled at providing health care for your child in the school setting. We complete individual healthcare plans, emergency action plans, so that everyone knows what to do and feels comfortable, and you feel comfortable with the services that we're providing for your child. And we ask that you are part of that healthcare plan. And while a majority of it is based on what your provider writes, you are intricate in that plan being carried out at the school level. We are definitely there as a health care advocate for your child, not just in the school setting, but at your provider's office, in the community practice. So we, our nurses are, thrilled to go to appointments with you if you need that. Oftentimes, so that there's great communication and relationship between everyone involved with taking care of your child. We precept, nursing. So the nursing students and medical students and pharmacy and public health students out there, we do offer preceptorships with University of South Florida, as well as University of Tampa and Florida Southern and South universities. We always collect data so that we are always in the quality improvement. We're always trying to improve our healthcare and see how we can do things better. So we love hearing from you. And I certainly would love to have feedback on how we can do things better. Or if you just want to share compliments, we welcome those too. We are a critical piece, as you all know, that we went through together with COVID, is maintaining a safe environment for students and staff. So a big part of our job is surveilling communicable and infectious diseases. And part of that is, and the piece that you can help with is making sure that your child is adequately immunized and you're adequately immunized against vaccine preventable diseases. Our whole goal and main job in the school setting is to make sure that we increase access to care. So, with a form and at no charge, if that's something that you need, then we will definitely provide access to health services for your child. We also provide physicals, sports physicals, school entry physicals for those that are in need. There's no charge. There's programs at every high school called the Healthy Student Program. There's no fees for that program as well. It just requires a parent consent form, and based on some protocols, some forms completed with your child's health history, we can provide limited over-the-counter medications. Your child could be seen by a physician or nurse practitioner at the school site, at the high school level. And again, that is at no charge. We also do screenings. And so we do vision, hearing, body mass index, scoliosis. At some school sites, there's dental services that are offered. So for more specific services like that, there are separate forms for like the dental programs that we may offer at the school site. And then the vision services, where we have partners that sometimes come to the schools, screen your child for, dilate their eyes, and then provide glasses on site. That's through the Glazer Foundation partnership and Lions Eye Institute, as well as the Brandon Lions Club. And so we're thrilled that we're able to offer that to our community at no charge. And like I said, our services are about reducing barriers. So rather that be dental, vision, hearing, or any medical, concerns that you may have, our job is to overcome those medical concerns that can impact your child's day at school, and make them feel, know that, it's just a physical condition, but we're there to normalize their school day. So thank you for joining us this evening. And if you have any questions, feel free to put them in the chat.
Good afternoon, everyone. My name is Ann Townsend. I'm the supervisor of psychological services for the district. Next slide, please. Thank you. There are approximately 150 school psychologists employed by Hillsborough County Public Schools. Each school has an assigned school psychologist, and as Mrs. Saya mentioned a little bit earlier, we might have some vacancies, but every school is being provided coverage. It's important to note that school psychologists work hand in hand with the other student services personnel that have been highlighted today and will continue to be highlighted in this presentation, because we see ourselves as team members, and we'll talk about that in just a moment. But I also want to share that every school psychologist has to be certified through the Florida Department of Education. They are either working as a clinical psychologist or a school psychologist with at minimum a master's degree in psychology or psychology related field. Our primary role, and it's not our only role, but our primary role here in Hillsborough County Public Schools is to assist with completion of multidisciplinary team evaluations. The school psychologists complete the psychoeducational portion of those multidisciplinary team evaluations. So in circumstances where teams, parents may request an evaluation, the students be considered for special education services, Section 504 accommodations, or maybe consultation with private practitioners. Those requests are made at the school setting or the school level, and school psychologists are typically one member of a team that would complete those evaluations. The great thing about the psychoeducational evaluations that are provided is it's not just to determine eligibility for a program or ineligibility for a program, because that is, again, determined by a team, but school psychologists provide recommendations that parents and educators within the district can use to support the child emotionally, socially, and academically. So oftentimes we will collaborate and consult with various individuals. So we look at those special education program eligibility and services with other team members. We collaborate with teachers, administrators, paraprofessionals, other student services folks. We work with parents and families, and we have community partners. If a parent would like us to consult a private practitioner, we just ask that parent to sign a release giving us consent in writing, and we're able to have those conversations and share information as well. So we assist with both site-based crisis situations. So our site-based school psychologists will collaborate with the school nurse, school social worker, school counselor, or counselors in order to provide those services right there at the school site. But in situations that require a little bit more support, we have a district-based team of school social workers, school counselors, and school psychologists who will travel from site to supplement the services that that team at the school would provide. Short-term counseling is provided. I did see a question within the chat room asking a little bit about ADHD and social skills counseling. So any one of our student services members might be able to provide that service, and oftentimes it's done in a small group setting rather than one-on-one or individually. And we also work with teams to identify what would be interventions or behavioral supports that could be put in place and monitored for students. Now, in education, oftentimes you hear a little bit of jargon. You might hear a lot of acronyms and abbreviations. And as parents, we want you all to be empowered to stop and ask, what are you meaning when you say CST or FBA, PBET? So you'll see a string of different abbreviations there in that bullet towards the bottom of the left column. And so when we're looking at Section 504 accommodations for our students who've been identified with disabilities, or having CST, child study teams, to discuss possibility of giftedness or special education eligibility for students, looking at functional behavioral assessments and positive behavior intervention plans. Whenever you hear a school team start to talk about these different teams and abbreviations, please stop and ask them to explain exactly what they are. But school psychologists are members of these teams, and they're designed to support students. We promote positive culture and relationships, particularly understanding and acceptance of the diverse student population that we support. So looking at cultural, gender identification, linguistic differences and diversity, we want to make sure that we're supporting all students from various cultures and backgrounds. In high need crisis situations, we do provide that guidance and offer the support that I briefly mentioned. We serve in leadership roles when it comes to selecting interventions and supporting, as well as how we monitor and collect data for the child's response to interventions. And we will provide training for professional development in different topics based on the needs of specific sites. So we have trainings we've offered to other educators on the site, but we also extend training sometimes in our open house events at school sites to parents and other members of the community. Next slide, please. So we'll kind of jump a little bit into something kind of heavy, and we'll hear a little bit more from the mental health team, Ms. Dean and others, Mrs. Dean rather, and others are on the call. But we want to make sure that we identify who has a role in supporting the mental health of students. And sometimes we fall into situations where we want to make sure that we're doing everything we can to prevent suicide attempts, suicide completions. So this particular slide illustrates that every single individual who comes in contact with children has a role with prevention. So from the principal and assistant principal to school counselors and other student services team members, to educators, to the school resource deputy or officer, to other students, and to you as parents. Each one of you play a role in supporting the mental health of your child and students. Next slide, please. So let's talk about preventing suicide and what are some of the factors that we want to consider? Well, we have a district protocol. It's actually vetted through Nova Southeastern University and the University of South Florida that identifies methods in which we screen and partner with one of our community partners, Grace Point, to prevent suicide here among our students in the district. But as parents, it's important for you all to be aware of protective factors, risk factors, and warning signs. So protective factors are those characteristics believed to increase the health and well-being of individuals. An example of those would be connectedness. Does the child or student feel connected with individuals at home, with a trusted adult or adults at the school setting, have a friend network? Having social isolation is not what we want. That's a risk factor. We want children to be and feel connected with others that they can talk to and relate to. Also, we have situations in which we have students who engage in healthy outlets when they're maybe under stress, maybe to express themselves, and those healthy outlets could be participating in sports. They might be artistic and creative that way. Different ways in which we can help the child express how they feel in a very positive way and help them cope with the stressors of life. And then I think lastly, in terms of protective factors, and they're far more than what I'm sharing with you today, but having access to those organizations, individuals, and communities that can partner with families and with children to provide those services. So having access to mental health practitioners is key in terms of a significant protective factor. What are risk factors? Well, think the opposite of protective factors, right? These are characteristics that increase the possibility that an individual will attempt to end their life. And so when we look at students who do not feel connected, if they feel socially isolated, not connected with others. I'm going to get a little bit closer to the mic because I see someone says the volume is erratic. So I'm getting a little bit closer. When we have students who feel that they're not connected with a family support system, maybe with adults at school or with a social group, that's of concern. If we have students who have a family history of mental illness, mental disorders, or if the child himself has a history or has been assessed and diagnosed with a mental disorder, that would be considered a risk factor. So there's several that we can look at, but think in terms of risk factors or what put a child at higher risk as opposed to protecting them from suicide attempts. And then what are some warning signs? Warning signs can be erratic behavior, a change in the child's behavior that's significant. Maybe looking at differences in terms of how often they talk or communicate, their sleeping habits, their eating habits. Warning signs can also be making statements about wanting to end their life, having a plan, having a means by which they want to live in their life rather than live and persevere, or having access to something that might end their life. So what we want to do is reduce those risk factors, be aware of those warning signs, and definitely increase the protective factors. Next slide, please. So just some resources that can be utilized by parents, educators, students themselves. We have here in Hillsborough County, you are learning about the Student Services team members that are available at school sites. An excellent resource is the Crisis Center of Tampa Bay. Their number, just like you would call 411 for information. You know, a lot of people use their smartphones now just to surf the net for information. But back in the day, folks would pick up a phone and call 411 to get information. Well, you can dial 211, or you can go on the Crisis Center of Tampa Bay website and access information about a variety of services that are available across Hillsborough County, not just the school district, but Hillsborough County, that provide different levels and types of support for different reasons. Mental health, housing, physical health. So please keep 211 in the back of your mind. And some of you all also know that for years, nationally, we've had a suicide prevention lifeline that was 1-800-273-TALK. That lifeline is now being changed into a suicide prevention and crisis lifeline, which is 988. So for those of you who are aware of the 800-273-TALK number and have committed that to memory, that is fine. We've been told that that is going to be up and running indefinitely, although we're trying to get this shorter, easier to remember number 988 for suicide prevention and crisis support. So please mark those numbers, mark them somewhere mentally or in paper, but we do share this information primarily with our middle school and high school students.
Hi, everybody. Thank you again for joining us. My name is Elizabeth Tanner. I'm the Supervisor of Emotional Wellness. I'm one of the supervisors that helps us oversee our mental health plan, and we're going to talk a little bit about mental health services provided in the district. Angela, you can go to the next slide. Thank you. So first of all, just really quickly, when we think about mental health, what does that mean to you, and what does that mean to your child and student? Mental health is a person's condition that involves their psychological and emotional well-being. When we start to talk about mental health concerns, disorders, or illnesses, we're talking about a medical condition that involves a change in behavior, a change in perhaps your child's emotions, their thinking, their behavior, or even a combination of those. Mental health disorders, we like to say sometimes to make it a little bit more understandable, is often impacting a student's ability to live, to laugh, and to love, to make those connections, to be able to function in society, to be able to complete their schoolwork, to make their responsibilities, become very social. So if you start to see changes in behavior with your child, with your student that you work with and see on an everyday basis or what have you, contact someone in our student services, someone at your school site, and we'll be able to give you the resources that you need. So we look at the next slide. We often hear from parents the question of how can I get help? Where do I start to get services? And the answer can vary as a simple one. A very easy one is your school site. Start there. We are a resource for you to understand the mental health process on getting interventions, services. We have the wealth of knowledge to give to parents on how they can receive services for their child. Okay, so a lot of times we get calls from parents, school personnel, the student themselves report that they're having concerns and they're noticing changes in their own behaviors. And then sometimes peers sometimes report to the adults on campus that they need to be seen, or they're having either emotional concerns, mental concerns, or even academic concerns. Then your school personnel will be there to kind of get that information, talk to those folks that are reporting the concern, and then in turn meet as a problem-solving team to talk about interventions that are most appropriate. When we talk about interventions in regards to mental health, it could be referrals to the student services team on campus. Just like what you heard from those folks before me, the psychologists, the social workers, the school counselors, nurses, all of those folks on campus can help your child if they're having mental health concerns. But we also know that the schools can only do so much during the day. Sometimes we have to refer into the community, and we have many community partners that provide mental health services such as therapies, evaluation, more intensive therapeutic type services to deal with mental health concerns or illnesses. And we can help families and students get connected to the appropriate mental health resource in the community. And then we always follow up and continue to monitor their child's progress to ensure that they're making progress with their mental health. And of course, we want the parents to be very involved in that process and understand the services they're getting and the progress that is being made. We can go to the next slide.
Good evening, everyone. I'm Maggie Dean. I'm the department manager with the mental health team, and I help to assist with overseeing our mobile response team. Next slide. So the mobile response team, this is a newer initiative that was created with our mental health team and very closely with all of our student services team members. And you got to hear a little from Ms. Townsend talk about how many stakeholders kind of play a part when we're talking about suicide prevention. So this is one sliver of that suicide prevention model that we have in place to help support our students. This process is multi-layered, and we want to ensure the safety of our students and that we're getting them the appropriate access of care of what they need. So this mobile response team, what it consists of are licensed clinicians that can provide consultative services to our school-based student services. So again, that student services at the school-based site are your school psychologists, school social workers, school counselors, school nurses. So we're able to provide some consultative services to see if we need to do a more comprehensive assessment. This mobile response team is mostly geared toward when students are in a mental health crisis, and we're specifically honing in on that suicidal ideation or thoughts of suicide or killing themselves. So we want to make sure that they're supported because it's a very sensitive subject and it's very scary for the students as well as for the parents. So the first piece that we always talk about with our teams are those de-escalation strategies and getting the child or the student to a calmer level where we can get an accurate depiction and screening of how is the student feeling? What are the thoughts that they're feeling? We also consult with the parents and guardians on a regular basis. You all have so much knowledge on what's happened for the history of your child and what current services they're getting. So you're a big piece in this process as well. With the parent notification, whenever we're utilizing the mobile response team, we have a contract with Grace Point where they're able to come to the site and provide a comprehensive assessment to look at suicide and see how we can make sure we have a good plan to keep the student safe. Sometimes we look at a Baker Act, sometimes we look at diverting services. Excuse me. So in order for us to deploy a team, we always involve the parent. You're always involved, and we actually get your consent prior to any type of deployment. Why we've moved toward this model is historically there's been a lot of involvement with law enforcement to do those assessments for looking at Baker Acts. With this model, we're able to use licensed mental health professionals to make that assessment and determination when it's safe and appropriate for the student. We're also providing this assessment in the least restrictive environment, which is somewhere they're comfortable, which is their school site. So we're trying to reduce the likelihood of trauma of an unnecessary Baker Act and getting them connected to services. But we all obviously are always looking toward trying to do what's right for that individual student in this time and in this moment if they are having a mental health crisis. One piece that I would like to talk about with the mobile response team, there is a community mobile response team that's available throughout hours, and they are through Grace Point as well. But this is a specific contract to expedite services during school hours. So this isn't a service that we offer outside of school hours. It's specifically during school hours. And like I said, you all would always be involved in this process. If this is something we're looking at, you will be involved, and we will get consent from you all, and you'll be there as part of that support and safety plan for the child throughout the whole care management. Okay, thank you so much.
Good evening, everybody. My name is Michael Kelleher. I'm Supervisor of Clinical Care. I work with the mental health plan for the district. I help oversee our district mental health clinicians, and we have 6 clinicians right now that work with every school in the district. So they cover a lot of ground. They work facilitating those relationships that Ms. Tanner talked about earlier with our mental health providers. Another responsibility I help facilitate is our threat assessment procedures for our school district. As everybody knows, we had a tragedy in Parkland, Florida in 2018. From that, many state initiatives happened. Some of those were about school safety, mental health, and threat assessment. Unfortunately, it took something like that for a big focus on the mental health piece. So what we like to talk about with threat assessment is that proactive strategy. Okay, so we really work with our teams and our schools to prevent violence as a violent prevention measure, to put interventions in place, whether it's mental health, or supervision, or family support that can really help that student. It really is a community-based model. So we tell our families and parents, see something, say something. Same with our students. If you're noticing things, behaviors that are unexpected at home or things that don't seem right, we have a lot of social media these days with postings and things like that. Let somebody know. Let somebody at the school know. If it seems imminent, you can let law enforcement know right away, please. We do have anonymous tip lines also through 4 to 5 Florida for reporting these types of things. So we really want our parents, our community to understand threat assessment and really that it's a proactive strategy. We will have future trainings coming in the near future this school year for our community members on threat assessment and threat management. Just so you all have a better understanding of the process and really understanding that it is a supportive measure. And we see a lot of great interventions coming of this, where we find early on ways to intervene with students so that they can be very successful in school and in life, and it keeps all our schools and communities safe. This is an example of the guidelines we use. This is a state requirement. You see here the comprehensive school threat assessment guidelines. Each school district in the state of Florida must use this protocol. So our team members are trained. Team members include school administration, our student services folks who you see on the call today at the school level, perhaps any teachers that were new to student. Parent input is very vital. And then law enforcement is also a required member just for that safety feature. So again, we work really hard with our teams to deal with this issue. But as a parent, if you hear something, see something, or read something online that would cause you concern, please reach out to your school or law enforcement if it's a more imminent nature. So thank you.
Okay, so another portion of our mental health plan focuses on the emotional wellness of our students. If we go to the next slide, here are a few activities and programs that we are doing to promote emotional wellness with our Hillsborough County students. One of them is to provide teachers with a lot of awareness training regarding mental health. The state has adopted youth mental health first aid training that all educators, all district employees in Hillsborough County must take to learn about mental health issues, mental health illnesses, disorders, and then how to connect students to the appropriate resource in crisis and in non-crisis situations. So we provide training to those staff members, all staff members, so that they can become youth mental health first aiders. We also have partnerships within the community, such as Sandy Hook Promise. These are violence prevention and emotional wellness type of programs that are led sometimes even by students and by staff to increase a student's connectiveness with school. So a couple weeks ago, we had our Start with Hello week, where students learned how to be kind to one another, to invite students to learn. And we appreciate our partnership with Sandy Hook Promise that encourages these type of student events. We also have adopted a social emotional learning curriculum with our student services department that we are encouraging our staff to implement with students. Second step is an SEL, social emotional learning curriculum, that teaches social skills to students. The more these type of coping and social skills students have, the less likely they are to develop mental health concerns, and they will have the tools they need to deal with any type of social situation in the appropriate way. We also have many programs where we are encouraging students to be leaders within their school building, to advocate for mental health wellness and mental health, lowering the stigma per se regarding mental health. So we encourage all of our students to participate in activities that involve understanding what these mental health concerns are and how students can get help. We have an advisory committee that's in our high schools where students are part of the district advisory committee, and they meet every 6 weeks and talk about not only mental health issues at their school site, but ways in which students can reach out to their peers, provide ways for kids to understand how to get help and what that help might look like, but also to encourage kids to talk about their issues, talk about how they're feeling, and seek treatment. So we're very excited about our student voices, our student leaders in the building, and we appreciate all of our partners that help us become an emotionally well district. Can we go to the next slide?
Okay, so this next section, MTSS is the multi-tiered system of support. And I'm sure many of you have heard schools tell you that they need to check with how your child is responding to the interventions that they are trying. So next few slides, we're going to talk about this process and the child study team. So these are just the basics of our multi-tiered system of supports. There are 3 tiers. Tier 1 is all students. Every student, it's what's happening in the classroom, how teachers are supporting the entire group of students. It's an entire school, and how are students doing as a whole at that tier 1. Then when students need some additional support, you can see it's a framework that we use to make sure that students are given all the support that they need. So sometimes students are in tier 2 because they require a little bit more. They need some extra tutoring, perhaps. There's many different things, and this can be whether it's academic or behavioral or social emotional. Those are just the areas that we can help students with at the school sites. And when we're going through these levels, schools are using the data that they have on each student through the various assessments that they do with students. So we're looking at students and we're problem solving around how we can better support your child to make sure that they are successful. And at tier 3, those interventions are truly designed for individual students and ensuring that students' needs are met. So with the next slide, once we go through that multi-tiered system of support and students, we're seeing how they respond to the various interventions, then it might be necessary for the child study team. The child study team is a multidisciplinary individuals of the educators. You as the parent are part of that team. Any other stakeholders that might be represented in your student's life, as well as the administrative team and a member or all members of the student services team, because this is truly a team that comes together to see what next steps need to be taken in order to ensure the success of your child. Our goal is to make sure that all students are successful. So we want to make sure that we're looking at data and we're coming together to see what's best for your child. So we're at the end of our presentation. So any questions? I do see that there is one question in the Q&A that I can see, and it's, Angela, would you like to take care of it or would you like me to?
Oh, no, Holly, that is so fine. Thank you all so much for that very, very high level overview of what you all do. You all are so fantastic. So I can read the question. It says, I have a student who has attention deficit disorder. She already had poor social skills with being able to make friends easily, but with being out of school as a home learner during COVID, these social skills were really an issue last year. Is there any counseling for social skills?
And yes, I think that Elizabeth answered that in her statements that she was talking about for her sections. We do have different counseling that is available to students. So just check with your student services team member, whether that's your school counselor, school social worker, or school psychologist.
Thank you for that. Are there any other questions? All right. Well, thank you all so much, team, social services team. Like, I really always enjoy your thoroughness and explanation. And I am just still in awe about the amazing, amazing resources that you have for our students and all the things that you do. And you all are just on top to make sure that all of your counselors, your social workers, your mental health folks, everyone, we're all working together to help our students. But families, we're here to help you too, because we all know as a parent, we need guidance. And so this team is here to help you, point you in the right direction. So just really tap into the resources that you have available for free. So come on in, contact your school social services team at your child's school so they can help get your child. If your child is off track, get them back on track. And with that,
Angela, if I could add something, please.
Sure.
I just want the families to know too that they can always check our website, the Hillsborough County Public Schools website. We have a plethora of information on that website as well. And we are working in collaboration with another division right now to create a special portal for students to access. And you will be getting some more information about that in the near future. It's called Hillsborough Assists, and we're trying to push that out so that families can have even more information at their fingertips. So
this thing at
thank
the
you
tap
so
of
much.
it. Yes, that's going to be it. That's going to be awesome. And we will keep you informed. You all will be getting a follow-up email. And thank you for joining us tonight. And with that, I want to tell everyone good night. Have a good evening.